discussions. I will do a little bit of theory just so grounding wise and get us going. I do have internet issues today, so just if in case I start freezing, just pause. It'll just be a moment, and I should be able to I'll get back on. I'm on hotspot, but I think should be okay. So I'm one of the reasons why I love this discussion is like because I think doing equity, diversity, inclusion work, a lot of it is about the implementation and how we do it, and having time, more conversations around what are different practices people use, what are some strategies others are using, and how they're overcoming the challenges. And so that's why the case studies that we're going to go for through today, they're very broad, but they're also an opportunity for us to discuss things together. So there will be some breakout rooms. We'll be in about 25 minutes. So for those of you who are off camera, and when you're in the breakout room, I do suggest if you can be on camera, just so you can connect with others in your groups as well. And that breakout work will be about 10 minutes or 15 minutes. If you just want to listen, join a breakout, just feel to just not add yourself to the breakout room, but you can stay on for the discussions afterwards as well and listen in. And so today, we one of the biggest things, so over the last, I'll just kind of share a little bit of my own bias around equity, diversity, inclusion work. Since I've been doing this work for about 25 years, a little bit is but some of it I kind of got tired of it because I was like, are we actually moving the needle? Are things actually happening? Can we actually get beyond awareness? And obviously we know during in 2020 with the murder of George Floyd, it really, people started really thinking about what does this look like and what does this mean? And then even since then, there's been such a polarity of on the topic in many discussions. Like I've done surveys with large organizations here in BC and even globally, where the amount of racism I've encountered on the surveys, just racist comments, has astounded me. And it was really about like the polarity around like why is this in one hand I took it as like well this work when people make those comments sometimes it's a good thing there's a organization can make change. However, there was also this other level of like, what can we do to continue this work that needs to get done? And that has been important for us as a field since the 1960s. What's important is like, and it goes back to the application implementation piece as well. And what we're going to do today, we are going to look at the intersectional and gender-based lens again a little bit, the power, privilege, and bias. I know some of you have done this before, so we'll spend just a little bit of time on that, and then we'll rest focused on the strategies and dialogue, and actually talking through ways that we can kind of work together, work on within our organizations, from the knowledge of each other. So the key topics are going to be around privilege. I know that this group, I'm sure that it's not going to be the word is fine, but in many rooms I go in, there's a lot of stigma around the word privilege, and it's always interesting to talk about that and discuss how to address that privilege as well and address the stigma. How to take a trauma-informed approach, ageism, and what does that look like, the anti-racist lens, and cultural understanding, and the GBA plus as well. And okay. Um, and also, this is meant to have an inclusive dialogue. Yes, the session is recorded, but when it comes to discussion times, we will. I know that we'll look at that. Please have honest, open conversations with the fear of judgment. Communities are small. Kind of make sure that we're not talking about cases or talking about individuals in a way that's identifiable. That's really important. Limit judgments where possible. Also, like, don't have the fear of judgments, but also limit judgments. Um, Confidentiality is what we talk about. Keep here. Um, Outside, it's please don't share it around the case studies, some others, because that could be identifiable to someone else. sitting with the discomfort rather than deflecting from it. Many people in this group are used to that, so I don't have to say that again. But also, please take care of yourselves. I mean, one of the biggest things about this work is why there's been high levels of burnout for individuals in this field is the fact that the self-care, making sure that you're taking care of yourself, the journaling, the self staying hydrated, movement, also talking through the experience with trusted colleagues. Like many times I facilitate sessions and I do a debrief with a friend of mine afterwards just to kind of say, this is what it came up, this is how I handle it. And that's an important piece. And that's actually the biggest piece about having this community of people as well, where you can reflect upon that. What does that look like? On how you process the information, but how is it applied as well? And also honor there's emotional labor that exists here. And it might bring up, your own patterns, ancestral patterns, your familiar patterns and experiences that you've had. But then it's also remembering that this is a space where you can need different tools to deal with that as well. And then also just access your own resources, whatever is available to you. So, as many of us know, the session is not about, it's about understanding where we're going and how to apply that lens and how to be advocates in a different way, possibly. It's not about getting trained to be anti-racist in a single workshop. It's not about debating whether systemic issues exist. We are taking the lens that those issues do exist. It's about beginning the conversation, and it's not about performative EDI, which many people on here don't do performative. So, the real privilege and power. I know many of you have seen this before. This one. How many of you seen it before? If you can, I can't see everyone, so if you can maybe just pop in the chat, yes or no. I know I'm breaking off a little bit. Sorry, I'll try to, the internet, I'm trying to make sure that it keeps stable. Okay. So with this Wheel of Power and Privileges, whenever, I actually just did it with her session last week. And interesting because the conversation comes around, well, I'm a person of color. I've immigrated to this, the country. What kind of power and privilege do I have, and how can I utilize this? And I would love, to one of the things that I use this example for quite often is getting people to actually do the ranking on it, you do the count how many areas of power and privilege they have on this wheel. I know there's different ones as well. And it's just it's out of 36 and you count how many steps, how many places there is. So that's an exercise I actually do with a lot of my leaders that I work with. And I also do with any times that we're working with staff. Because many times people kind of forget, aren't fully aware of the privilege that they might have or how they can help someone else. I just on a session earlier this week, we had this one woman. She was like, she moved here from a Latin American country. She speaks English, and she's like, one of the biggest things is like she goes, I know that I'm treated differently in workplaces, and every time she leaves a workplace, she actually gets unionized, and that's actually how she's using her power and privilege of having English as a language and understanding how the unions work. And she goes, it helps people get their employer rights, and so it was really interesting because then others were like, oh, wait a second, so you just came here like 3 years ago and this is what you're doing, and so she kind of talked about her journey of how she used her position of like her education and the language and as a way to kind of navigate spaces for other people as well. And so it's just something to always be reminded of how we use our power and privilege and what that does that look like. Who can you open who can you open a door for? What introduction can you make that would actually help someone else? If you're speaking on a panel, is there someone else that you can invite along with yourself as well? That will give them opportunity to practice their thought leadership. And just taking a moment, just like for like 30 seconds here, what's one way that you can use your power and privilege today or this week that you have, you've been thinking about, but you haven't done so far? Is there someone you can make an introduction for? Is there someone that you can share a job opportunity to? Or is there someone that you can help, take them to like a bank that they might, and then maybe English is their additional language and they don't have access to certain aspects. So just maybe take like 30 seconds and commit to one action right now that how you can use your power and privilege. If anyone feels like sharing, please do feel free to share in the chat as well. Like for me, for instance, my grandma lives in a home, and I was able to. I actually just went there, and I was just and she wanted a few things from the nurses, and the nurses don't speak her language, and they don't speak the same language, so I was able to advocate for her, and that was part of like how I was able to kind of be there for her at that time, which was it's a small deed on my part, but for her, she got more comfort, which is really important. So. One of the things also talking about power dynamics, I'm not going to spend a lot of time on this because I know many of you are very aware of this, the structural, cultural, and individual powers. One of the biggest things about this is how navigating these spaces by understanding when you're giving away your individual power and when you're actually holding on. So, an example of that would be someone was like, talking about being in a workplace. And this is a client of mine, and she was talking about being in a workplace. She's talking to leadership, and she's like, well, they keep doing all these things. And every time I go into these rooms, I don't have a voice, and I'm not able to speak up. And so just even looking at the language, I was like, well, what are the aspects where are you giving your individual power away? What are the aspects that you're thinking about? What can you control, right? And where I don't have a voice, well, that's an aspect that the individual can control and that they do have a voice. It's about do they feel comfortable using it? So that's a different dynamic in terms of individual power. And when and she came from a culturally diverse background, so she was like, well, they, they're doing this everything in the very Canadian way. I don't get it because that's not what we did in my home country. And so going back to like the cultural power there and the dynamic of like the the context of like Canadian culture, what does that look like? And giving it more power than the fact that she had 10 like 20 years of global experience. And I was like, well, how are you using your global experience in this context and using that the power that you have of understanding global context and global language and global experiences, and how are you bringing that into this workplace and having them understand the value that you're bringing as well? So that was a whole example of individual and cultural power. And then from there, we did talk about how that influences like policies and strategies and what does that look like. So the power dynamics is something that, is always thinking about what, again, our locus of control. What can we control? What can someone else control? But also where can I influence the change? And when is it possible to bring my past experience and have more appreciation for it to be more of a, influencer in creating the change in power dynamics as well. Um, and then what we're going to talk here, just I'm going through this content a little bit fast, just so we can get to discussions. How many of you have seen the anti-racist multicultural institution kind of spectrum? We can just pop it into the chat as a yes or a no. Anyone? So with this spectrum, this is a really I love it's I got it actually from a church, I think. I found it originally I had found it on a church, but you can just search for it online using this prompt. And it's a really positive, powerful spectrum because it really kind of shows like what aspects do you need to be anti-racist, and what it means to be multicultural. Many cases, we multicultural organizations. I used to work in the UN system, and they were like, "Well, we're not really racist because we're multicultural. We represent all aspects of the world." But it was also understanding how what the difference was between the two and how that actually shows up within cultures as well. And understanding how the diverse cultures actually impacted the organizational culture, that was an important piece. But the anti-racist structures and the policies were really important in order to have individuals thrive culturally within the organization. So this spectrum really allows you to dive into deep into aspects of it, looking at the analysis, thinking about what are the systems and the processes that are in place, but then also how does the organizational culture influence that as well. One of the things around this, working in the Lower Mainland, Metro Vancouver, I guess not Lower Mainland anymore. I just aged myself because Lower Mainland's like I don't know how many years ago. Um, when we're thinking about this, it's really thinking about you have to kind of be both anti-racist and a multicultural organization and really allow for both aspects to come through. And so policies and processes really need to reflect both of those and to have like the full participation of individuals. And so that there is that the cultural nuances and the cultural relevance for the programs that are offered are are really integrated into the way that the program delivery is done, and also the services that are provided as well. And also making sure that we're, obviously, when we're thinking about inclusive design, who is actually influencing the design as well, and how are we engaging them? And are we engaging a certain economic level of that population, or are we engaging different levels of that population? I say that because many times I'll get asked to do focus groups, and which is great that I get asked to do them, but I represent a certain demographic. And many a times when we're doing these focus groups, I'm not the demographic they actually need to be targeting because I'm not the one that, first of all, I don't like I'm obviously South Asian background. I was born and raised in Canada, so my experience also is very different than someone who has a very strong South Asian cultural like attachment. And they really identify with that in a big way. And so I'm not going to be able to, if I'm a part of a focus group, I'm not going to be able to speak to that as well. And then we have to think about education levels, economic, where we're born and raised, all those things, as we're thinking about how we're engaging different populations in design as well. And I'm going to switch completely over because all of this applies to these case studies we're going to do. No, when we're even thinking about multiculturalism and anti-racism, is also thinking about the trauma-informed approach and how that actually impacts program and policy development and delivery. And are we think the way that we're asking the questions and the way that we're engaging with the community members, are we is there any way that we're re-traumatizing, or are we actually providing relief? And which practitioners and providers need to be a part of the evaluation of the services. That's such an important piece as well. And then also what kind of questions we're asking. Are they necessary? And are they going to be, triggering in some way? And so that's such an important piece of having a trauma-informed care approach to the way that we approach organizations, especially these days when we have so much happening in the world. Many people are impacted by it at so many different levels. I mean, constant conversations around, I have family in the Middle East, or I was going to fly out there, but I can't anymore. So there's and I mean, that's a first world problem, but still, it's someone's reality. My business is impacted because, some people are like, my business is impacted because most of our clients came from those regions and they've kind of shut down. They had contractors in those regions, and the contractors aren't able to work right now because of the trauma that they're facing. Or individuals that are, in Canada, but they're watching the news and it's reminding them of past traumas that they've experienced as kids. And so that trauma-informed care approach to in organizations is like it's one of the most important things that we can do right now. And I know that we're talking about it, but it's more, I work with a lot of international NGOs. In the international NGO space, we talk about it way more than we do in any of the other spaces that I work in. But the trauma-informed approach to organizational culture needs to be kind of actually be embedded in a much deeper way, where and where it's become a part of the conversation and a part of the care of like the how managers are provided training, how managers are, like the resources and tools that managers have so they can support their team members as well, and how team members can support one another. And it's also when we've gone through we saw this during COVID, and the pandemic, and we're seeing this now. Everything that's happening in the world in this last so many years has impacted people's capabilities and people's productivity, also um, their bandwidth. And it's important to take that trauma cared approach in order to support them as well in there. And if there's questions in between, please like just feel free to pop it in the chat, or you can unmute yourself as well. I'd love to get questions. So when we're doing the trauma-informed lens, when we're thinking about it, is we want to continue to support we know what has been done and how it's easy to be complacent in these spaces and how to be a passive bystander as well. But again, using your power to change structures, empathy, compassion, are so important. Support policies that reduce race, gender, and ableness as well, ableness and equity as well. So systems one, two, and three thinking, systems one and two thinking is how we actually influence how we show up within these systems, but then actually we can influence policy. Systems one is where bias exists in my viewpoint, because that's where fast, intuitive, we no thinking is required. It's about based on what we've known from before. Systems two is when we actually become more anti-racist and we become more trauma-informed because we're thoughtful. We think about the consequences. We think about what else is possible, and we're actually being conscious about any of the interactions we're having and how that's going to influence someone else. So systems two thinking is such a powerful way of approaching the world. Also would help with reduction of burnout in many ways. But it's also just like it requires the slowness and the pause that we were talking about in decolonized ways of working and decolonized ways of being. And it's actually a really powerful place when we start thinking about the global south and how much of the global south is actually in the systems two thinking, in many ways. And this is my bias because they do take a more calm, collected approach to relationships, to projects, to way that work is being done. And where here in the Western world, we're actually quite quick in how we approach things, and sometimes that's why more bias exists as well. And that's my perspective. And then with the systems one and two thinking also impacts how we look at cultures, depending on our experiences with different cultures and what they govern. Um, Many of you probably seen this Hofstad's cultural dimensions, which I do really love the cultural dimensions because I think they're really, really important. But one of the biggest things is stereotypes start to exist between this and the culture map, which I'm going to go through the next slide. Because we start to place people based on, if we think about collective societies and we're like, oh, they're from, I'm going to say India, there must be more collective than individualistic, but we're putting bias in around what we think they might be based on the country they're from, rather than them as individuals. When we think about feminine and masculine, we have some cultures that are a little bit more feminine, and then some that others that are more masculine. Again, we might put bias on like, well, they are like this because they're from this country or they're from this culture. So this is important to know, important to understand the cultural dimensions and how different cultures sit up where they sit on them, but also remembering that individual still individual. Just because they identify with certain cultures doesn't mean that they're going to be on that part of the spectrum as well. within any of these aspects. And the same thing with the culture map, Aaron Myers. Like I love the culture map because it's always so interesting when you think about different cultures and the way that they, as a country, the culture that they have. But then when you tie in the individuals, cultural aspects of like their big, big culture piece of as individuals, what culture is influencing them. So like say you have someone from Africa in France, the way that they communicate and the way that they um their schedule might be very different than someone who is a French born in France and based on upbringing and so many other criteria as well. So I love the culture maps, but I also take it with a grain of salt because we can't just pop people where we think based on their country that this is where they should be on the types of styles that they might have as well. As we know, everyone's an individual, and we have to really think about people as taking the human-centered approach. How do we see people as individuals and actually apply that thinking to the way that we operate as well? So one of the things I do love to talk about with this, even just in terms of culture, is ageism and how that impacts. We know that we've talked about youth a lot, about what are the perceptions that we have about youth, especially different generations, how, I don't know how many times I've heard lately, oh, the Gen Zers do this, or the Gen Xers are like this, and these groupings that we do. I still like to pretend I'm a Gen Xer, but I pretend I'm a millennial all the time because I try to like operate that way. And it's really fun to like try to switch and people try to confuse people, which is not never happens. Then we have the early career and what they might look like. And then it can be limiting to someone who's actually really such an amazing person, but they might be limited by their youth or the amount of experience that they might have. Like I'm going to take the UN system for example. They have a certain number of years that you have to have experience in order to get a certain number of jobs. Right away, they're eliminating certain mindsets and certain individuals in their job because the criteria is so strong on what they will allow in. And so it's always an important thing to think about. Like it's good to have the early, like these criteria, but who are you eliminating? What experience and expertise are you eliminating as well? As we think about menopause and midlife and what does that look like and how that actually influences the workplace. I do a lot of work in gender equality. Many of the reasons we know that women leave the workplace is because the workplaces aren't made for women who are going through perimenopause and menopause. And men do go through andropause, it's very different. Their experience is a little bit different. But we need workplaces where are looking at those policies. We're looking at ways of supporting those experiencing perimenopause and menopause in the workplace. And what does that mean? Especially if someone's doing IVF and how that actually influences their work as well, because that it changes their brain chemistry, as we know that menopause and perimenopause does too. And when we have these organizational structures that are made actually for a certain type of man, um, we are eliminating everything else that might exist, that might need to exist based on another population that isn't being looked at as well. And then, as I mentioned, diversity across thought across generations. Diversity of thought is really the focus for me when I'm looking at this work and how do we apply that to any programs and stuff we're doing. So applying the gender-based lens, I know you've already looked at it, is looking at the identifying intersecting identities, analyzing the systems and barriers that might exist for those identities and what are the inequitable outcomes. Where can you involve impacted voices? And those are the people who can center their lived experience, co-design with them. What does that look like? Um, we implement inclusive strategies as well and evaluate outcomes. One of the things I will add to this from a trauma-informed approach is the concept of hope. How can you provide hope to those individuals that hope that the program service is going to amplify their aspects of hope? So we are going to do a couple of case studies now, and we're going to break out um, into rooms. And so we have 5 case studies, and how many people do we have? 20. So what we'll do is four people per room and per case study. So we can have five breakout rooms. The first one will do a pay equity blind spot. And really, I didn't provide a lot of direction on these case studies because I wanted you to think about, okay, we went through the trauma-informed lens, the gender-based analysis lens, and also thinking about just inclusive design. What are the things that you would consider if this was a problem within the organization? And what are the questions that you would consider, and what are some of the possible solutions that you would come up with? So it's really two questions, like what questions and solutions. So pay equity blind spot. So this one, group one will do this. It's a compensation review reveals disparities that a gender neutral policy failed to detect once race and seniority were analyzed together. So we see this quite often. We see that people are like, oh, we have women and men, there's pay equity. However, when we start bringing in race and seniority, then you start to see that there's a discrepancy between there. Leadership pipeline. Promotion data shows that the women of color consistently passed over despite strong performance reviews, a pattern invisible when gender, race are analyzed in isolation. So another thing of like, how would you approach it? What are the opportunities? And what are the questions you would ask? And what are the possible solutions? A refugee mental health program. A well-funded mental health initiative fails to recognize this intended population due to language barriers, cultural mistrust, and colonial program design assumptions. So what would you do in that instance as well? Accessibility disconnect. Disability accommodations are available on paper, but the approval process, timelines, and attitudes create de facto barriers for those who need them the most. And harassment policy reform. A harassment policy is revised following complaints, but without input from marginalized staff. It replicates existing power imbalances in new language. So we are going to go into breakouts for, I was going to say about 10 minutes, and then we're going to come back and do sharing from each of the groups. And then we'll kind of further discuss each of the case studies. So if we have the breakout rooms ready.